So ready? Okay. So today I'm going to be talking about my Ethiopian experience because I think that it was an excellent experience with teamwork, and it really taught me a lot. And so we were asked to travel to Ethiopia, to their capital city of Addis Ababa, and to teach emergency education for physicians and nurses. And so there was an adult group who actually taught adult skills and knowledge. And then I actually concentrated on pediatric care and knowledge and skills for all of the physicians and nurses that we were working with. So just a picture of where Ethiopia is. It's in Africa, so you can see how far we had to travel from the United States over here, all the way. Wisconsin would be right about there, and Ethiopia is this country within the continent of Africa. So it's on Eastern Africa, and this shows you a little bit better where it's at. So this is Ethiopia here. And then this just shows all of the different regions and zones and kind of what countries are around there, and stuff. So Sudan and Yemen and Somalia, they all surround Ethiopia. Okay, and Antria. So it's a large area. So there's 1.1 square kilometers. They go by the metric system. And it's landlocked, and so there's not a lot of water on it. It's mostly land, but you can see some areas of water here, but not big bodies of water. Here's the Red Sea and the Gulf of Aden there. The capital city is Addis Ababa, where we were at. And so there's 9 ethnic-based states within the country of Ethiopia. And they have few natural resources, and they have mountainous areas. And so this is, see, one of their mountains is actually 14,000 feet high. So you can see that there's mountainous areas, and more than 50% is above 4,500 feet. So this is the hospital that we were working in. The picture on the left is kind of the main, well, there's 2 main entrances, but this is on the back of the hospital here. This is the Ethiopian flag, and they're very, very proud of their country. Even though they have so little, they're very, very loyal and very proud of everything that they do have. This is actually the waiting room for the emergency department there, and it's outside of the hospital. When you're looking at this area here, it's on the other side. Okay. And here are ambulances outside of their hospital, and they don't have an ambulance like a 911 system like we do. So all of their their ambulance services are private ones. And so you can see there's a lot of variety, and they look like our SUVs. And so not the kind of ambulances that we're used to. So. And this is how a lot of people were bringing in patients to the hospital. They would carry them, and they would have to carry them long ways. So they would come across the country to bring their sick ones to the hospital, because the hospital that we were in was a teaching hospital, and one of the largest ones of the country of Ethiopia. This is a picture of looking over from up above, and so you can see how close the houses are here in Ethiopia. And so there's not a lot of room in there. There's a lot of people in Addis Ababa, and they are very, very proud that Lucy was found in Ethiopia. And so that's the oldest dated remains of human existence. And so this is Lucy, and she was an archaeological find, and she's in the museum. They have several museums there that are absolutely awesome. But Lucy lives in the museum there, and so you can see her. These are the physicians that I was working with, the doctors. The one on the left over here is Dr. Tigist and Baca, and she, I still communicate with her, and the technology is absolutely amazing. So we were able to work together to get our flight team to help her with a little baby that needed to be transferred to Egypt for cardiac surgery. And so we did all of that through private Facebook, because they don't have helicopters in Ethiopia like we do, like you learned about in Ready Camp. They had to send the baby by private plane. And so they had to figure out how to take oxygen in a plane and everything like that. And this is Dr. Mulo, and she is the other. So these two ladies, and this is their director here, that he was the director of pediatrics, the Department of Pediatrics. And but these two ladies were the first people in the whole country of Ethiopia to actually receive special training to specialize in pediatric emergency care. So we were so happy, and they're both very good friends and remain to be very good friends. We still communicate, even though I went to Ethiopia from 2010 until 2015. I didn't stay there that whole time. We would go over for like 1 to 2 to, I think it was 3 weeks one time. This is one of the other hospitals that they take care of children in, Yakit 12 Hospital. And then this is the other one, Baria Pediatric Medical Service. And so that was the entrance to there. These were nursing students that we were working with. And you can see the white uniforms, and so you could always figure out where they are or who was a nursing student by their uniform. And then these were some of the nurses that I worked with. This is Diana, and Diana went with me from our hospital, and she was working with the adult nurses and doctors, and I was working with the pediatric nurses and doctors. So notice here, this nurse's outfit, this was actually a retirement party for her. And so all of the rest of the nurses actually gave her this outfit. This is a traditional dress of Ethiopia. And so you wear it for special occasions, and they actually gave me one too. And so that will be, you'll be able to see that later. These are some more nurses that I worked with, and here's my traditional Ethiopian dress that they gave me. And then this is Rahi, and she is actually living in Texas right now. So she was able to move here with family and is working there. In the previous picture here, Mohammed, he actually works in California. He's a nurse in California too now. So it's great. And a couple of them here, Wajini and a couple of others, they actually went to med school and they're physicians now. So, but we trained them. They received grant funds through some of the federal funds that are available, and UW Hospital worked with them to set up a training center. And so we would teach them all of the emergency skills. So see here, the bag valve mask there, and Yafet, I also talk with him all the time too through Facebook and stuff. And here's Rahi, and she's putting in an oral airway into the mannequin, and Yafet is actually bagging the baby here. And so they're learning about that. And I took this picture and put it in there because even though the Ethiopian people have very little, they're very, very poor, the lion gives them inspiration. And boy, if we can just think of that, because the lion is so strong. So you'll see lions all over. The hospital that I worked at was Takur Mbasa, and which means black lion. And so this is a statue of a black lion that was in the city. This is one of the little girls that I took care of, and you can see the stuffed animals. And so one of the community projects, actually, of Jordan's team, Bayview Community Center, Ready Camp, they actually gathered toys and clothes for me to take along to Ethiopia, and that was their community project. They also, this is actually in the new hospital that they built. They were in an older hospital when I first went there, but the sheets on the bed were also, they had a drive and they sent sheets through their Ready Camp to Ethiopia and stuff. So here's some more of the toys, and this is another one of the patients here in the hospital. And we took suckers, obviously, and so they don't get any toys or treats or anything, so the children absolutely loved it to be able to have those toys and everything. So this other little girl, I think she was a sister to another patient in the hospital. This is one of the streets of the marketplace, and so you can see how they have outdoor markets and have like lots of fruits and vegetables and all kinds of things. You can buy things up and down the street here. This is these are other stores that are available and that you can go to, and we bought a lot of our water. We couldn't drink water from the faucets there because it had bacteria in it and we would get sick. The Ethiopian people can drink it because they're used to the bacteria that's there, but we couldn't. So we had to buy bottled water to drink. Here's another picture of some of the markets. This was across the street from the hospital. And so we would get all of our souvenirs to bring back home in this area. This is their food in Ethiopia. This is a traditional meal. The bread here, that's right around here, that's called injera. And that's all made out of, I think it was 7 different types of grain, but very healthy for the Ethiopian people. And so they would have other little things on top here and that they would put in, and you would take the bread then and you would roll up the inner types of things. This is an egg right in the middle of it and stuff, but it was fruits and vegetables and very, very little meat in there, but there was meat available. And this is a coffee ceremony. This was actually at Dr. Mulo's house, and this little girl lives with her and helps her with a lot of the cleaning and cooking and stuff like this. So they actually grind the coffee beans and then they cook it and then they drink coffee. They drink a lot of coffee in Ethiopia. And it's one way to connect with each other. So it's like, it takes like 3 hours to make coffee by hand. But everyone just gathers around and talks and has a good time and connects with everyone during that. This is a lady coming into the city with, you can see the donkeys. The donkeys were carrying different things that she was going to sell in the city. So this is very common. You could see the donkeys with it. Otherwise, they carry it themselves and stuff. So I'm just going to check. I noticed there were, whoops. This is again, see this little girl, and she was bringing in these sticks to sell in the city. And we would go up into the mountains, and all of the people who live in the country would have to carry this on their backs. So think about that, how fortunate we are, how lucky we are that we don't have to do that. So I'm just going to look at the chat box. Oops, for some reason it didn't come up. So hold on a minute. Oh, I clicked it instead. So here's another little girl carrying like wheat and grain and sticks on her back to the city to be able to sell it. And see, I have fruits on a stick. Look at here. Isn't that cool that they're eating that? Okay. For some reason, I can't get to the chat box right now. There's another little one carrying the sticks to the city from the up in the mountain area. And they would gather them. Here's again grain being brought to the city on the donkeys. This is a typical house in the rural area. And so they would actually build these houses and see the tin roof. Those who had tin roofs actually had more money because that wouldn't be blown away. They have a season, a rainy season every year in the fall. And otherwise, if you have a grass roof, they have to rebuild it every single year. So this one is actually a better house there. There's another one, a round one. And so that's, again, more of someone who has more money than the other ones without the grass houses. These are churches that are there. They're absolutely beautiful. That's Greek Orthodox is the primary religion of the Ethiopian people, otherwise Muslim. And so they would gather around their church every day of the week. And this must have been through Lent. So through Lent, they cover up the pictures, and then on Easter Sunday, they open them up. But look at the very unique designs of the church. And so all of the churches that were in, see there's 3 sections. So there's the inner section, which only the priest is able to go into, and then the middle section, and then the outer section. So the Father, Son, and Holy Ghost is what that represented. Here's another church of a different kind, a different design. And here's like the stairway to the church, and you can see lots of people there. And this is a monastery that we went to up in the mountains. And inside the churches, there are very unique pictures that are painted on the walls. And I put this in here basically because all of these colors are made from flowers. They actually pick the flowers and they make their homemade paint. And then they paint these pictures inside of the churches. And so you can see all of the bright colors. Ethiopian people, even though they're very, very poor, they love bright colors. And so isn't that cool? And some of those lessons that we can learn from them. This is an older man, older gentleman on a donkey or on a horse that we found. And then he was with all of these children were around him also. So I'd asked them if I could take their picture. And so I just think I'm fascinated by the people in Ethiopia because they're so kind and so nice, and everyone, they would just do anything for you if they could. This is one of the wells, and I'm not sure if you've heard in African countries how they're trying to improve the water systems and stuff. So people actually walk to the well where there's a well dug into the ground here, and then they fill up these yellow water containers and then they take them home. So think about that. If you didn't have running water in your home, how you would have to go and get your water every day. and then take it home. And then one of the doctors, Dr. Tigas that I showed you, she lived on a third story, like an apartment, like a flat, and she would have to carry her water up 3 stories up to her area. So here's another picture of all of the water containers. And then these people are taking them home to their homes. So they must have just stopped and took a break, or there's a filling station there. Here's some more of the African children, or the Ethiopian children. Just beautiful children, and I just loved them. They could not, some of them can speak English. When they go to school, they are taught English, and when they graduate from high school, they have to take a national test, and that national test is in English. And so we were trying to connect like some of the Ethiopian children with some of the American children so that they could learn English better. And so through technology, but the time difference was the difficult thing, because they are like, where's my phone? So right now in Ethiopia, I have it on my world clock. So in Addis Ababa, it's 9:02 p.m. So it was really hard to connect the children because of the time difference and everything. And they don't have, sometimes they don't have electricity, and sometimes they don't have internet service. And especially in the rural areas, they don't have internet service. It's only in the city that they do. This is another scene from like down in a street, and you can see they do have dumpsters and stuff here. But the city is trying to clean up and have people, instead of living in houses like this, they go to apartments. And that's why I have this picture in here. This is an apartment building on the right, and then this is how some of them live, in those small little huts. This is in a park, and so this little boy was following me around, and it was so fun to have the children just follow me around all over the place. And so I took a picture of him by the monument. These are in the bathrooms. These are hair dryers in the bathroom of our hotel. And so just wanted to show you the difference of what they look like. And so we were fortunate enough to have a hair dryer in the hotel, but I used my own instead. And this is another little boy. And so see all of these stuffed animals, which they called puppets. They would call them puppets, any stuffed animal. But you couldn't, I looked all over for my grandchildren to buy toys. And it was very, very rare that you could find toys. So they were so happy to get those toys. And here's some more little children. And look at those beautiful smiles. Aren't they just gorgeous children? This is a little boy in the hospital, and he must have been a brother of one of the patients and stuff. So, but we, my grandchildren would send along like their backpacks from school if they didn't use them anymore. And so he was happy to get a backpack. And this little girl is dressed with some of the clothes that were sent from the Bayview Community Center. The Ready Club had put together some clothing and sent it with, and that's some of those clothes. And this is how they carry their babies. On their back is with this cloth here, and then they would wrap the baby in the cloth and then carry them on the back. And and this is in the scene in the city too, and just to think how dangerous this is, but they're probably going to work. Transportation, it's not easy to get around in the city in Addis Ababa or anywhere in Ethiopia. So they don't have like bus, they do have buses, but they are so full because there's like so many people who live in the city. And so it's really hard to get from one place to the next. This is Tigas, her nephew. And so I had to get a picture with him. And this is, so I've got the scarf on my head because I went to church the one day, and that's how they go to church. So that doesn't mean, like in America, you might think it would be a Muslim, but it's not. But the Muslims and the Christians get along really, really well in their country, and it's really hard. And here's outside the church again with more children, and they would all come up to me, and it was so cool because I loved to have the children around me. This is one of the priests inside of the church, and so got a picture with him. This is another little one that was at one of the houses of a friend that we went to, and that's his mama. And so these are more children here. And this is another way of getting around. See, with the horses, or sometimes they had donkeys, and then these homemade buggies that they would get around in. So, and these again are more of the houses out in the country. This is one of this was the Bayview Community Center. They had a clothing drive for all of the children in Ethiopia. And so I was just so fortunate to be able to take all of this clothing and help the people in Ethiopia. And then these children all have clothing too from the Bayview Community Center Ready Club. And so one of the little boys, oh, it must be the other picture. There's two pictures. Oh no, there he is. He's got Green Bay Packers sweatshirt on. See? And that's in Ethiopia. And this is one of the festivals. So see all the bright colors? They have tons of bright colors. And so they have festivals for so many occasions. And this is one of the fruit markets. Isn't that cool to see all of the fruit that was available for to purchase? And these little girls, I went up and down the street with and danced with. They had drums. See the little drum here? And so we would go up and down the street and drum and sing. And I would sing some American songs, and they would love it. They were trying to sing it with me. This is another picture from across the street from our hotel. And these people here are called street cleaners. So they go around and they clean up the streets and pick up like all the paper and things like that. This guy was selling brooms. So I don't know where he got them from, but anyway, he was just selling things. They do anything that they can to make money. And see, here's a very nice home here in Ethiopia, and see the barbed wire so that they protect their home that way. They have a fence around it, and then they have barbed wire so that no one climbs over the fence and robs their home. This was a car wash. I just thought it was so funny. Look at the picture of the car here, and then they drive their car back here, and then they clean it by hand. They don't have the automated car washes like we do. Here's some more children, and this is another traditional Ethiopian dress that I actually bought while I was there. There's the other traditional dress that my students gave me, as well as a necklace that I absolutely love. And so, but this was one of our training center rooms. And so we would have lots of people around this table here that I would train the staff, the nurses and the doctors and everything. And so, yeah, so that was cool. And this was on the 6th floor of the hospital. And I loved this, this painting, and they would have pictures in several different areas there that they keep on hammering. So even though that life is very difficult for the Ethiopian people, they keep on hammering, they keep on going, and they don't give up. And I think that's such a great message. And I just learned so much from them related to this, that And this is with a bunch of children there. And so we all joined hands there. This is my arm here with a bracelet that I bought at one of those stores, the things. So that's my presentation about Ethiopia. And as I mentioned, it was such a great experience. I absolutely loved the experience and learned so much from the Ethiopian people. So trying to find the chat. I can't get it to show up for some reason. Let's see. So anyone have any questions? I'm gonna stop sharing my screen and maybe I can. Oh, there we go. If I stop sharing my screen. So yeah, so oh, Damien asked about yesterday. Yesterday we did meet, but it was just about the community projects, and so we talked about that. And so I didn't record it or anything. So, and Damien says his mom is a coffee lover. I too, I love coffee, and I brought a lot of Ethiopian coffee back home with me too. And Janice says, yeah, the rainy season is in a monsoon, and it is. Oh my, I should have included some pictures. I was trying to find a bunch of them yesterday. I was never there during the rainy season, or actually during the worst rainy season, so I don't have pictures that I took, but I do have pictures that my friends from there sent me of the rainy season, and it's just crazy. The streets there are just full of water. And so and Damien says it was a thunderstorm yesterday from 5 a.m. to 7 a.m. in Milwaukee, and yes, it was a storm by our home too. Actually, there was a question of a tornado may have touched down in Rio, Wisconsin, which is very close to where we live and stuff. So any other questions? So see how many opportunities are available once you are in like any of the emergency professions. So some of the doctors went with us, other nurses. We had many people who were part of our team, because you can't do it all on your own. It takes a team to be able to do that. And then I was also going to show you American Family Children's Hospital. I found this really cool video, and that we can watch here on YouTube. And so, oops, hold on. I will share this in a minute.
Ever get the feeling you're being...
Skip the ad.
Last month, Governor Evers issued the official proclamation declaring...
All righty. So share my screen, and I can find. All right. Here we go. So when you see the condition there in Ethiopia, every time that I went, I would just keep saying to the nurses and the doctors how fortunate we are. We are so spoiled. And so this is our hospital, the hospital that I work at. And so you can see that, and Children's Hospital in Milwaukee is also the same. And so it was very interesting to see how well people work together with hardly anything available. Like they don't even have running water in their hospital. They had to bring in those yellow containers for water, for washing your hands. You had to use the other water. There wasn't any running water at all. And like washing up patients and things like that. And so
The entire
just the
year of 2020, the 100th anniversary of pediatric care at the University of Wisconsin.
A hospital, of course, is never a place that you want to visit, but from the moment you walk into the lobby of the American Family Children's Hospital, you realize it is a special place. Dr. Ellen Wald, the chair of the Department of Pediatrics, and Barbara Byrne, vice president at American Family Children's Hospital, took us on a tour. The 8-story, 111-bed American Family Children's Hospital opened next to UW Hospital in 2007.
The Children's Hospital is themed after all things Wisconsin.
Oh, I love
So each floor has its Wisconsin themes, and that actually came from our parent advisory group suggestion. This is the Door County Lighthouse over here.
Very nice.
And then as we go around that side, it's the old streets of Wisconsin. We were really trying to make it a magical place for children so that when they walked in the building, it wasn't this frightening, sterile environment. So I think they did a really good job.
The hospital is in a different league from children's hospitals of the past, and the way in which care is provided has evolved too.
As much as possible,
Yeah.
we've tried to put elements in that help a child feel comfortable in the environment so it's not so frightening. Because you can imagine, right, walking in here and seeing the equipment on the, on the walls, etc. That would be frightening, and it still is to a certain degree, but we definitely try to take the edge off.
The campground.
Yep, the campground. And so everything in here is designed like you're going camping. So walk on into the campground.
Let's go for a hike.
Yeah. This is a parent waiting area, and again, a little stoop for the tree trunk.
All you need are some s'mores.
And she helps them prepare for surgery, and she helps them pick out what smell of gas they might want today.
I have a little menu.
What are their choices? Like,
Grape, strawberry, watermelon,
oh my goodness.
Yeah.
Bubblegum. You use
bubble gum, root beer.
Oh, you're
So,
kidding me.
yeah. Parents have already visited the playroom, and then they're like, "Oh my gosh, we talked about this at home, look at," and they can play. So, sometimes my job is partly done, but it's nice because I can reinforce it, or
Yeah.
I can come here and play. And I don't have my backpack with me, but I have like the stickers they'll use and the leads and all that stuff. So yeah, so sometimes we're helping the baby go to sleep, and then I bring out a mask their side and say, "Hey, look, can you try with the baby?"
Tyler's place is a place that siblings are able to be cared for in this environment. So if siblings are coming with a family to a clinic appointment, they're able to drop their children off here. This is a hybrid OR. And in this room, this is only one of a couple ORs in the nation.
What is a hybrid OR?
It has the most precise equipment to visualize and to target whatever procedure that they are doing. So they'll do cardiac catheterizations in this room. They do other interventional radiology procedures in this room. So this is water theme on this unit. And yep,
We're in the canoe right here.
This is our level 4 NICU, and you can bring a preemie here, but really we bring children mostly who have surgical complications, surgical congenital problems, heart disease, abnormalities of their gastrointestinal tract, abnormalities of their lungs.
this is 7. Yeah. So 7 is the skies of Wisconsin. And so that theme was selected in part because these children are complex care children. And so many of them spend a moderate amount of time when they're hospitalized in bed. And so we wanted them to be able to look up and see different things. These folks are able to pick up when they see a seizure that you might not be able to see otherwise. They're able to pick it up, and then they will contact the service immediately to say child's having a seizure. See the light above the bed.
Mm-hmm.
And again, now this is intended because children spend a lot of time in their bed when they're here. They're able to
look at that.
they're able to tell us what color they would like their sky to be today. This is the Positive Image Center I'm going to show you next, and this is one of the only children's hospitals that we know of that has this to offer children.
So we have this space where they can get out of their room and come down here and have their hair done or get fitted for a wig if they're experiencing hair loss. And then I have a cart too that I can bring up to the rooms.
And you can do
And
makeup.
do makeup and nails. Yeah.
Such a good idea. At that Positive Image Center, patients get the full makeover treatment. The cosmetologist does nails, she shampoos, and even colors hair. Like she can spike it up for kids if they want to, and patients can come in often as they want. There are 19 child life specialists who help children and their families cope with the fear and anxiety associated with being in the hospital that you saw earlier. That was the little replica you had of the toy operating room that kind of helps kids calm down and exhale when they go to the hospital.
Very welcoming place.
It's so state of the art, but you would never have, you would never want a reason to have to go inside. So
But you have to.
yeah. So thanks to Barb and Ellen for giving us a glimpse and how lucky we are to have it here.
We are lucky.
Hey phone, connect to Wi-Fi.
So see what the difference is. And so it really gave me a great appreciation in going to the Ethiopia and learning from them. And so I learned as much from them as what they taught or that I taught them. So so that's a great opportunity. So if you're interested in becoming a nurse, those opportunities are available. I was very, very fortunate to have been chosen to go and do that. So, all right, Damien has a question. Can I do the impact driving as a TikTok video? Absolutely, definitely. Anyone can do anything for any of them, and then just submit it. And if you have, that's the very cool part of it, is it's to be innovative, and you can create your own ideas, take your own ideas, bring them to life, and we will learn from you as you do all of your community projects too. So, all right. Any other questions from anyone? Okay.
No, that was my only question.
Okay, great, Damien. All righty. So we will join tomorrow. I'm hoping maybe Blake will be able to join us tomorrow. And then Friday will be the banquet, and we're waiting to see what time Paul will have to work till because of everything that's happening in our state. With civil unrest, we don't know what time he's going to be off of work, but I want him to be able to join us too. And I will be at my daughter's house on Friday, and so you'll get to meet all my grandchildren too. So I get to do that fun thing on Friday.
Aren't the activities due Friday?
Yes, activities
Okay.
are all due Friday. Mm-hmm. So
I just have to do the QPR training, the impacting driving, the recruitment, and the 2 recruitments, and drawing, the drawing one, and one other thing, the wilderness survival. That's what I was asking for, the wilderness survival.
Okay, we'll try to get some clarification from John. I'll email him right after we're done here and ask him to send, he has all of your email addresses, so he can send out what his ideas, what his thoughts were related to that. Okay. All right, so we'll connect tomorrow. I'm not sure what the topic is going to be, but we will definitely connect tomorrow, okay? All right, it's been so much fun. Thank you guys for all joining.